Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Haley.
Hi, Dr. Luper. How are you?
I'm doing really good.
Good. Well, this month we have been focusing on autoimmune diseases, and something that we see in the practice quite often is celiac disease. And so I kind of wanted to get a better understanding of this, and what exactly is celiac disease, and how does it turn into a disease from just an intolerance?
Okay, so you had, your thoughts are very similar to a lot of people around, and there's a misunderstanding here, which is celiac, that we treat a lot of celiac. We almost never treat celiac. Now, we treat wheat sensitivity. I mean, there's not a week that goes by I don't have somebody coming in with wheat sensitivity. I've had 2 people today already who had wheat sensitivity, and it turns out to be instrumental to their case. So celiac is an autoimmune disease. That's kind of why we're doing it, because it's an autoimmune disease. But it's not that common when you really get down to it. You know, 1 in 250, 1 in 500 people, somewhere around there, have actual proven celiac, which is not that many. Whereas people with a wheat sensitivity, what is it, 1 in 10?
Yeah,
and something
everybody
like that.
out there is gluten intolerant, you know, all of the restaurants, all of the stores.
It's much more common now than it used to be, and that's another show why.
Yeah.
I don't know why. I have ideas why.
Okay.
I have theories why, but if we had time at the end, we'll go into that one.
We can have a theory episode later on.
So the thing about wheat sensitivity, let me just back it up and say celiac. Let's do celiac first, and then we'll talk wheat sensitivity. And let's talk about this thing that's similar between both of them. They're almost the same in one way, which is they're both sensitive to wheat. And you eat wheat and you get sick. And so you quit eating wheat and you get better. I mean, what's the difference? They're exactly the same, except for they're not. Because with celiacs, what's really you're looking at with celiacs is your immune system is triggered by wheat to cause damage to the lining of your digestive system. A very specific kind of damage called sprue. And sprue is when that velvet lining of your digestive system, those little villi, those little finger-like projections that pack in tight, and when you look at it, it looks like velvet, those die off.
Okay.
Not completely. What they do is they go from being long to being short.
Okay.
And when they get short,
they don't absorb as much.
Exactly.
Okay.
And so people with celiacs, if it just continues on, will die of starvation.
Because they'll be malnourished. They haven't been able to absorb any of their nutrients.
Or not enough. I mean, a little bit, but not enough. You lose 80% of your absorptive capacity, and you're only going to get 80% of your nutrients if everything's running, tip top.
Sure.
And it's not because the damage that's being caused by the white blood cells is such that it breaks down even cells that are working normally, and they can't work normally either. So really, people just don't get enough nutrition because they don't get enough nutrients, better way to say it, even though they're eating plenty, but they can't absorb it. And so this is a really serious disease. It causes diarrhea, it causes pain, it causes anemia because you don't have enough energy to make blood. It causes your digestive system fall apart and causes death. I mean, celiac absolutely can be a deadly disease, absolutely.
With prolonged kind of symptomology, does it take it
takes a long time,
months and months,
years and years before it's all falls.
It's not an immediate.
No. It's a slow starvation type of thing, is what it is. And so the good news is docs are aware of this, and they'll run tests to be able to figure out what it is well before you get to the point.
Are there direct tests?
Yes.
Okay.
Kinda. That's a good question.
Other than inflammatory markers?
No, yeah, other than just inflammatory markers. Normally when we have an autoimmune disease, what we see is a C-reactive protein's elevated. That's an inflammatory marker. Sed rate's elevated, same thing, inflammatory marker. Stuff like that. And in this case, same thing. Those are all elevated. But the celiacs, people really gone out of their way to try to figure out a blood test for this, because the old test, it's still to this day, the gold standard test, is to take a sample of the lining of someone's digestive system and look at it under a microscope. This is called a biopsy.
Not just a stool test?
I'd rather not.
Yeah.
You got somebody who's really sick, in a lot of pain, suffering, right? And then you go and send them to the hospital and have them open their guts up and take a little snip out of their digestive system?
Yeah,
No, that's really, we don't want to do that.
No.
So if we can avoid that, we will. Doctors are highly motivated to avoid taking those samples.
So they have created a different type of test.
A blood test. There's a blood test. There's a blood test panel, and I won't go through every single part of the blood test panel. Let me just go through two parts of it. One's called an endomysial antibody test, and that's pretty good for celiac. If there's not many things that'll make that go high other than celiac, so that one's elevated. Good chance you got celiac. It's not 100%, but it's a good chance. And then the other test that makes the percentages even better is to do a certain kind of antibody called secretory IgA antibody. The antibody to gliadin, notice it's not gluten, it's gliadin. That one goes up, and that one correlates very well with celiac. And so you put those two tests together, and you got a real good chance with somebody has celiac. Now, again, the gold standard is to go do a biopsy, but biopsies are real problematic with these people. We'd rather not do it. And all we really need to do is just figure out if they have celiac, then have them quit eating wheat, and then they get better.
Would it be something that you could determine with a stool test?
Not really. Stool tests aren't particularly helpful with this. Stool tests we run all the time. They're very helpful. And what you're going to see is a lot of leftover food because you're not absorbing it, and you're going to get a lot of infections and overgrowth bacteria and fermentation and all this other stuff. That goes without saying, though. It's not particularly diagnostic. It just shows that their guts have gone to hell in a handbasket.
What about the sprue itself? Is there like a specific test that indicate the dying
Only
villi?
Only by looking under a microscope.
Okay, so
that's how you do sprue. So now the celiac sprue is not the only kind of sprue there is. There's other infections that you can get, usually in tropical countries where they'll attack the lining of your digestive system and kill you. And those called tropical sprue. So celiac was also known for a while as non-tropical sprue.
Okay.
And so this is too much information. There's kind of as time
know.
evolves. So really the bottom line here is that you got a sensitivity to wheat. It causes an immune reaction. The immune reaction kills the lining of your digestive system, which eventually will kill you.
Yeah.
So what we want to do is avoid wheat. That lets the immune system calm down, allows the lining of the digestive system to grow back, and now your life is saved. Now, it's an oversimplification because there's lots of things that you could do to grow their digestive system back.
In between.
Yeah, and if I talk any more about celiac, I'm not going to have a chance to talk about the much more common problem of wheat sensitivity. So there's this other thing called wheat sensitivity. It's not celiac by definition, but what it is people eat wheat and they get sick. It causes problems with them. You can get, again, immune system problems. It's like celiac's light is what it is.
Okay.
So people will get stomach problems, they'll get diarrhea, they may get colitis, they may get a rash, they may get headaches, they may get sinus problems, they may get joint pain. So there's a lot of immune things that go along with this wheat sensitivity, but it doesn't necessarily fall into the narrow definition of celiac. There's still lots of problems, lots of immune system problems. And since it's such a broad category, instead of just a narrow category, there's way more people in this broad category than there is in this little narrow category. So we see lots of people in this category, very, very common to see. And again, the similarity is that you have them avoid eating wheat and they get better. Okay, so full disclosure here, my lovely wife, who I adore, has this.
Oh, yeah.
And so
you dance
by definition, I have this.
Okay.
Because of my association. Because what she has, she lives a certain way. That means I live a certain way.
Yeah, you gotta
and so
be the supportive spouse.
We don't eat wheat in a lot of things. Like if it's dinner, we don't eat wheat in dinner. Now, the kids, because we have an exchange student right now, and I have a 9-year-old son, and so they can eat wheat. Occasionally I make pancakes. I can't eat them because they're pancakes, and Christy can't even get close to them because she'll just have a reaction to them. The kids do just fine.
She can't even be in proximity of them?
Well, she can't do anything. She can't eat anything where near them.
Okay.
Now, this is actually a big question, a good question, which is, if you're sensitive to wheat, how much wheat can you eat? The answer is a little. No, not none. Celiac, it's 0.
Okay.
You can't even get in a place where there's wheat dust in the air.
Oh.
I mean, they're that sensitive. Okay. Any amount of wheat will generate a reaction. Specks of wheat. Where somebody with a wheat sensitivity, they can eat a little wheat and get away with it. Typically about 1/8 of a saltine cracker. Hard to make a sandwich out of that.
That's great. Or even put that on your soup.
Mm-hmm. No, any more than that, it's a problem.
Okay.
So we went to a restaurant and bought French fries, because those are made out of potatoes, right? So there's no wheat in French fries. Except for they took the French fries and they shook them in a little bag with a little bit of wheat and a little bit of spices, fried them up. They came up super crisp, fabulous, super good French fries.
Best French fries,
and
for sure.
best French fries ever. And then she came home and said, I ate wheat. I don't know where. I said, wow, we didn't eat wheat. She says, I know I did. Those had to be those French fries. They were so good.
What are her reactions, if you don't mind sharing?
I don't want to. She gets puffy.
Yeah.
Like she gets that puffy feeling,
That
like
inflammation,
something's going on. Yeah.
swelling.
And then she'll get a little bit of upset stomach, and then the next day she'll break out in a rash.
Okay.
And the rash is different parts of her body. I have to be careful. I didn't get permission for her to say all this stuff, and we're putting this on the. Okay, I'm already.
You're here.
In for.
Sorry.
She gets this rash around her eyes,
I've seen.
like this.
I've seen.
Yeah, that raccoon thing.
Yeah.
She does the raccoon rash. Not a fan of the raccoon rash.
No.
I'm okay with it, but she doesn't like it at all.
We can say it's a superhero mask instead of raccoon eyes.
Yeah. So when she gets into wheat, we know for sure.
Yeah.
We know because she gets this thing. Now, not everybody is like this, and I want to bring this up because are you just screwed forever? You can never eat wheat again the rest of your life? Can't I just avoid wheat for a period of time and then have it?
elimination.
Yeah, and then have it.
and then reincorporate.
Right, and then reincorporate it in.
after your immune system has calmed down a little bit.
Yeah, can we do that? In theory. Sometimes, in fact. Not always. Now, Christy, forget it. None of that worked. We tried a zillion things. None of it worked. She just can't eat wheat. But for a lot of people, you can avoid it for a while and then eat it, and then you do okay. Now, let me talk about theory and then let me talk about practicality. In theory, you could wait 3 months and have this happen because it takes 3 months for your antibody levels to drop. Remember, what's driving this thing is the antibodies. Mm-hmm. The antibodies to gluten and gliadin in particular. And so if you let the antibody levels drop, and then you're okay because you don't have a reaction to the antibodies.
Are there any supplements that'll reduce the antibodies?
Yeah, in the sense, not directly, no. You don't take something and the antibodies drop. No, it doesn't work like that because they're already made. They're circulating in your body. Okay. The only way you can get rid of those antibodies is to do that blood antibody cleaning thing where they have the electrophoresis, where they pull them out.
Yeah.
There's another name for that. And they could comb the antibodies out of your blood. It's super expensive, and I won't recommend it. No, what you can do is you can calm the immune system down and take away the impulse to make the antibodies and let the antibodies drop on their own. That's what you can do.
Okay.
So there's some herbs you can help with that. But I won't even talk about those because it's too esoteric. Really, the best thing to do is just don't eat wheat.
For a given amount of time.
3 months.
3 months.
3 months.
And then
let
slowly incorporate
Yeah, and then you slowly
at a
incorporate
very
it at moderate levels. So instead of let me tell you a story. So I had a guy come see me some years ago with a horrible rash on his elbows and his knees. This was a pussy, pimply, weepy, gooky, horrible rash. Then he had this rash for 30 years. Amazing, he kept trying to find solutions for it because he never found anything that would work. 30 years, comes to see me. I'd run the test, figure out that it's a wheat sensitivity. I take him off of wheat, the rash clears up, and he's ecstatic. He's like, "Oh, this is fabulous. I'm happy. 30 years I had this rash, now it's gone." I think, excellent, check. We win. We're good. And he comes back a year later, and I go, "What are you doing back? We already fixed your rash." And he said, "I figured out how to eat wheat." I said, "You did? I want to know. I'm so glad you came back. Tell me how you did it." He says, "Well, here's what happened. After my rash cleared up, and I waited a few months, I ate wheat, and the rash did not come back." I said, "Well, that's great. Then what happened?" He says, "Well, then I ate wheat again, and the rash came back."
So he can have it one time.
You get one free one.
He gets a one freebie.
Yeah, how often do you get it to work out? He said, well, it took me the whole year to figure that out, and I got it figured out now. I can eat wheat once a month.
Wow.
Once a month, and I don't get the rash back.
Huh.
Now, I'm not sure this is a good idea. I mean, you probably are better off just not eating wheat.
At that
But,
point,
I mean,
why?
I know it's worth telling the story because it's interesting.
Sure, and
Right?
if, like, you know, the occasion arises, there's a cupcake
And
right there.
you got your chance to eat your cupcake, right? And
Yeah.
you just, that's it. You're off for a month. You get one to charge you up, and then your antibodies go up, and then you got nothing and let them drift back down again,
Yeah.
right? And then one to charge them up, and then they have to drift back down again. I'm that same way with bee stings. If I get 2 bee stings, I end up in the hospital. 1 bee sting, that is one, and then a period of time later, the second one.
Okay.
I get 1 bee sting, I'm fine. I do not have to go to the hospital. I don't have to do an EpiPen. But from then on, for the next 3 months, I have to carry an EpiPen all the time because otherwise I get the second one and it'll absolutely put me in anaphylaxis.
Wow.
So 1 to charge me up,
Sure.
And
Get
then-
those antibodies elevated.
and then if I just get nothing, I never get the second one, I'm okay. It just naturally fades over the next 3 months.
What? That's incredible. That our body builds that response.
Yeah,
It
so we're
doesn't let it go.
not everybody gets that way. Some people
Sure.
are like they're already charged all the time, ready to go. They're going to run anaphylaxis all the time. Remember the celiac people? You can't
Exactly.
rub wheat near them and blow. They'll react,
blow it
right?
in a room next
So
to
they
them.
are super sensitive all the time. There's nothing you can do. You just got to avoid all the time. Whereas people with the normal wheat sensitivity, not so much.
So for the wheat sensitivity, I would think we'd run an IgA food sensitivity panel.
Yes.
And that would give us the level at which their severity was.
Yes. So that's a great test to run for this. This is an excellent test. The IgA correlates stronger with symptoms as opposed to the IgG. And now you and I are talking shop, and people are listening in our conversation. I don't know if this is the conversation we need to have. There's a test you can do.
They have the information now. They can do with it what they will.
Yeah, okay. So you're right. We want to run this antibody test. And if we do, we can get a sense of it. Now, we're going to run one just for wheat. Forget that. Why don't we just run the whole kit and caboodle and do 96 foods and get a sense of what your whole immune system's doing? That way you can dial in what you should eat and what you should not eat. And if you come up on sensitive stuff, there's a cross sensitivity. Let's say you're sensitive to lemons and you're eating lemons all the time, and you have a sensitivity kind of moderate to wheat. Your wheat sensitivity is going to get a boost. Just it's going to bleed over. There's a little boy that we see, and he's got a horrible rash. That's him.
Yeah. Okay.
Because he's sensitive to everything.
Yeah.
Everything went up in him. It was not the one thing. Everything's up. So we have to calm everything down, and then we can start sorting out his case and find out what he's really sensitive to, right? So there's a cross reactivity. So what you do is you calm things down as best you can, avoid what you can find out for sure that you're sensitive to, let the immune system calm back down again, and then either just enjoy life, right?
Right.
Because you don't need to eat wheat anymore like we did in the old days. In the old days, wheat was everything, right? It was
Yeah, but
every
now they
food
have
we had.
so many different options for
We
a
made
substitute.
we used to make 2 cakes on a birthday. We had a wheat cake and we had a wheat-free cake, right?
Okay.
Except for we figured out that the wheat-free cake was the better cake.
Yeah.
We quit making the wheat
Okay.
cake. We pitched. We don't. Who wants it? No one's going to eat it anyways. We want the wheat-free cake because it's denser and richer and more chocolatey, and it's just a better cake. So in our family, we eat the wheat-free one. We get it in a box at the grocery store, and we mix it up, mix food in, put the whole thing and bake it, and comes out cake. It's cake.
So there's workarounds.
Yeah, there's absolutely cake. So there's all kinds of cake and crackers and bread and rolls and scones and whatever. There's a zillion different things to eat now that don't have wheat in them. I did a trip down to Oregon, and I came back yesterday. And when I came back, my son Patrick was so happy because Mom made cookies. And I said, "Are these like wheat cookies?" Crazy thing for me to even ask, right?
Of course not.
Of course
You know
not. They were
better.
wheat-free cookies. They're fabulous. They're peanut butter cookies. And they don't hold together as good as the regular ones, so you have to make them smaller. But they were absolutely delicious.
Well, where's the cookies? Why didn't you bring it into the office today?
I could have. Well, we have peanut butter cookies at home now.
So I know we've been talking more about the treatment, more about avoiding food, more about elimination diet, and then reincorporating it at a later time. What other things might somebody be able to do during reactionary flare?
Okay, that's a good question. First of all, let me answer by saying, don't do that. Okay,
Yeah,
I'm sorry.
okay, the cupcake has been eaten. The wheat cake has been eaten. They are now in this flare, and this flare has lasted them a week, 2 weeks.
No. They're going to last a few days. It depends. If you get flared and flared and flared and you eat wheat and wheat and wheat, now you're going to run for a long time. So that's why I go back to my thing, don't do that. And if you do one, there's a good chance you're not going to have any reaction whatsoever. And if you do get a reaction, it's going to be mild because you haven't eaten wheat in a long time.
Okay, so they've eaten enough wheat to build this reaction up. Now, amidst the reaction, what are they supposed to do?
You decided just to throw caution in the wind and just eat wheat like crazy. Eat wheat. And now, you're bleeding from the eyeballs or whatever, right? That's an exaggeration. But, you're having this horrible reaction, right? Yeah. Don't eat wheat. I'm going to go back to there.
Anything else that they can do other than not eating wheat?
Yeah, everything we talked about on the last show, all the stuff that we would do is to treat Crohn's disease. So the anti-inflammatory tincture, we didn't mention glutamine, but glutamine would be a thing to do. Probiotics in general are going to be helpful. Chia seeds are going to be helpful. Drinking lots of water actually is going to be helpful. The solution to pollution is dilution. Those kinds of things to calm down your immune system. I can think of a bunch of more stuff too, but I can't help it. At that point, I'm enabling. Mm-hmm. No, stop. I don't want to enable anybody. Quit eating wheat.
Yeah.
Go eat something else. You could have a cookie, just don't have wheat with it. There's a workaround here and do it that way. That's a better advice. I'm going to get better results, easier, cheaper, better way to do that is just avoid eating wheat. Now, here's the tricky thing you didn't ask, which is just wheat? What about oats? Does oatmeal wheat? Is rice wheat? Rice is made from a grain. These are grains. Are they all the same? Do they cross-react? And the answer is there's some grains are very closely related, and there's a cross-reactivity with them. Wheat, barley, and rye are in the same family.
Yes.
So those will react. Also, wheat is not one thing. There's lots of different kinds of wheat. Mm-hmm. There's spelt, which is a kind of wheat. There's einkorn, which is a kind of wheat. There's triticale, which is a kind of wheat. So sometimes wheat has different names, and they're all wheat.
Yeah.
You think, well, no, spelt's different. It's like organic and natural, and I can eat spelt because it's not wheat. No, yes, it is.
Yeah.
And the other thing also to consider is, and I had this happen, this is a true story, where I say, turns out you have a sensitivity to wheat, you can't eat any wheat. And they come back, a month later, and I say, well, how you doing? And they say, well, I'm the same, I feel horrible. Are you avoiding wheat? Yeah, I don't eat any wheat. I only eat white. I'm strict white bread now.
No way. Oh, that's funny.
Ooh. Well, it turns out white bread is made out of the plant called wheat.
Yep.
Oh, it is?
Yep. It's not made out of the
That's
white
potato
plant.
bread. It's got potatoes. No, they use wheat to make potato bread.
Yeah.
Yeah, so you have to avoid anything that's like wheat. So what about oats? Oats are like wheat. They're kind of grow like wheat, right? They grow the little grass, the little stalk. The answer is, yeah, they're on the edge. They're close, but not quite. So they're not in the same family. They're in this other little subdivision over on the side. So the relation's a little broader between oats and wheat than it is between rye and barley.
Do they make oat flour?
They do. They make oat flour.
And I know they make almond flour.
And they don't. You can use these to make a bread-like substance, but there's no gluten in it. And so you don't get the rising. Here's the thing. The real problem with oats is not that they're oats and they're closely related or not closely related. The real problem is they grow oats near wheat.
Oh.
And so the wheat gets in the oat field and the oats get in the wheat field. And if you got a few oats and a wheat, who would care? You can't tell. But you get a little bit of wheat going in the oats, you got a problem. Now that oatmeal is generating a reaction because you have a little bit of wheat ground up into the oatmeal or ground into the flour, however it is. And so you have to buy a special oats that are grown in places where there is no wheat. That last year they didn't grow wheat, and so some of the wheat's growing up because the seeds landed on the ground and got mixed in. You can't do that. It has to be wheat-free all the way around, and it's going to cost you.
Yeah,
because you have to be more careful about it. And I'm not really into brands, but let me just give you a brand because there's a brand that's really great for doing this. Bob's Red Mill does a fabulous gluten-free, that is for real gluten-free, oatmeal, and that works fine. Most people with wheat sensitivity can do the Bob's Red Meal, and they do all right with it. Okay.
Now, I would think people wouldn't want to do oat because it's higher in sugar.
That's another thing altogether.
Okay.
So oats can be a good food and can be a problematic food. I mean, carbs are great if you can tolerate them. But if you can't tolerate them, if your insulin levels go up and you start gaining weight, oats are a fattening food.
A bad idea.
Yeah. I mean, I can't eat oats. I had to give them up. Make my blood sugars go up too much. And that was a sore loss. I mean, I love oats. Oatmeal is fabulous.
Yeah.
But I can't eat it anymore because I'm too sensitive to the grain. But that's the same way there's rice, same way with corn, same way with potatoes. They're all the same to me. Even though they're all not related at all, they all have the same effect. Hey, let's talk about another one that was just tricky. How about buckwheat? Well, it's got the word wheat in it. Buckwheat is wheat. But it's not. Totally unrelated. Totally unrelated. Buckwheat is not wheat, and you can eat buckwheat. People who have a wheat sensitivity do just fine with buckwheat.
What is buckwheat?
It's a grain.
That's not wheat.
That's not wheat.
They want to call themselves wheat.
Yeah, it's confusing. So with the buckwheat people have changed their name to kasha, which there's some culture calls it kasha instead of calling it buckwheat. And so they decided kasha was a better name. So anyways, there's lots of different kinds of grains that you can eat and get away with if you can tolerate grains.
And rice is good?
And rice is fine too. People who are sensitive to wheat can eat rice with impunity. And corn. And potatoes. And sweet potatoes. And a zillion teff and quinoa and amaranth. And there's a zillion grains. And thank goodness for that, because all these grains come into play when you make wheat-free foods, and they can incorporate them into the foods, and you come up with a better food that doesn't have wheat in it. So there's lots of foods that you can eat that are delicious and wheat-free. We know, because we live the life.
Yeah.
We eat all kinds of stuff all the time. There's some things that you wouldn't know have wheat in them. Couscous is wheat. So just,
I thought
by the way.
couscous was a grain itself.
No, it's wheat.
Oh.
Couscous is wheat. I don't know why they changed the name. It's because of how they prepare it. But couscous is wheat. I'm so sorry.
Or where it's grown. It's a South American.
From the middle. It's from the Middle East actually.
Oh, okay.
Couscous is a Middle Eastern food,
thought
and
it
they
was
take the
Peruvian.
grains and they don't grind it. They just like sprout them, or they soak them, or they do something, and they add some oil and some garlic and some chopped herbs, and we make this kind of porridgey thing. Mm-hmm. That's couscous. Mm-hmm. Yep.
Wow.
It's wheat. Sorry.
So, is there any last thoughts on wheat?
Let me look at my little list and see if there's anything else that I want to talk about. Yeah, more sensitivity things. Okay, let's say you have sensitivity to wheat and you want to not have a sensitivity to wheat. I said don't eat it and the sensitivity will likely go away. There's 2 other treatments that you can do that can maybe even work better than that. One of them is you can get tiny, tiny, tiny little injections of wheat, and then you get progressive injections. You get a little bit more and a little bit more and a little bit more.
Kind of like an allergy treatment?
That's an allergy treatment. That's
Yeah.
exactly what it is. You get allergy shots. Occasionally that'll work about 20% of the time. The chances are low. 80% of the time it fails, 20% of the time it works, but you want to give it a go. Mm-hmm. There's another treatment that uses acupuncture points. It's called NAET, Nambuchapad Allergy Elimination Treatment. And Nambuchapad is a chiropractor who practiced in Southern California and came up with this technique, and it works. I've used it. I've referred to it. I've actually had it done to myself and worked beautifully.
What did you have it done for?
Mosquitoes.
Oh, right.
I have a mosquito sensitivity, and in Fairbanks, that's a super bummer of a sensitivity to
Absolutely.
have. And I ended up in anaphylaxis twice after
Because
getting
of
bit by mosquito bites. And you can believe that? It's what a rough go. And I got treated with the NAETs, and I have not had a problem since. I used to just get flush if I got mosquito bites, and I got enough of them, and I'd lose consciousness and have to go to the hospital. And now I get these little red bumps that itch.
And that's it?
Like everybody else.
Yeah, okay. So mosquitoes and bees, good to know.
Yeah, I don't do well with stinging things.
No, obviously not.
So you can do the NAET treatment and just get, Google it and find somebody near you that does them, and you can get treated for it. And you got a real good chance of it working. It's not 100%. I don't know what the actual percentage is, like 50-50, something like that. What's going to work. So there you go. Something else.
Great. Alternatives.
Oh, one other thing. Other foods that would not that have wheat that you wouldn't know. Soy sauce is made out of wheat. Not always. There's some wheat-free soy sauces.
Soy?
But soy sauce is made out of wheat.
Is a type of wheat?
No. Soy is not wheat. Soy sauce is made from wheat, fermented wheat.
That's so
What a cheat.
counterintuitive.
Beer.
I feel lied to.
Beer is made from either wheat or barley, and barley's close to wheat. So
Right.
gluten-free people can't, or gluten-sensitive people can't drink beer.
Is there a gluten-free beer?
Yes, there is.
Oh.
They can make beer out of, cornflakes, oatmeal.
I don't drink, so I wouldn't know. I wouldn't have any idea.
Yeah,
Oat would be stout, right?
Oat is not wheat. Oat's different. Yeah, stout, right?
Yeah,
Oatmeal
stout.
stout, right? Not necessarily though. That's just because they cook the oats in a certain way. Oh, you're gonna make me do a show on beer.
I'm curious. I don't know.
Malt. That is malt that you would make beer out of, and also malt that you would put into a malt, right?
Yeah.
Like a milkshake. That's made of wheat as well. Or it's a wheat sensitivity. It's not necessarily made out of wheat, but it's made out of barley or another grain that's close enough to wheat that people can get a reaction from it. So malt is another thing that you can't do. Sometimes food starch, they can use wheat to make food starch, and people have a sensitivity to that as well. These words you really have to be on top of if you're celiac.
Absolutely.
'Cause you have to really
and
watch.
people who are celiac are on top of it.
Because they have to. Because if they don't, they're
know.
punished severely.
Yeah.
And they suffer intensely.
Yeah.
And so they're highly motivated to be able to find it. Yeah. Be real careful. Okay?
Wonderful. Well, I think we're about out of time. Thank you again for all of your insight. We appreciate it.
Hey, it's a pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.